are going to start with the BDA sheet tooth whitening. So whatever I have marked and highlighted the important key points on this BDA sheet, it's important, and if you are going to memorize only these highlighted points, that is going to be enough for your exam point of view. But if you want to read it fully, that's up to you. So let's start with tooth whitening. Whitening effects may vary depending on such factors as the type of stain, age of the patient, concentration of the active agent, and the treatment time and the frequency. Now, the products containing or releasing between 0.1 and 6% hydrogen peroxide can only be made available to the patient via treatment by a registered dental professional. So, you need to remember these values: 0.1% and 6% hydrogen peroxide. The key learning point is not that important, just give a good read. Tooth whitening, the regulations prohibit the use of product contain or release more than 6%. So, we will not use the product that contain more than 6% of hydrogen peroxide unless it is wholly for the treatment or the prevention of a disease. Okay. Now, the products containing or releasing between 0.1% and 6% hydrogen peroxide, these products can only be sold to the dentist and made available to the patient via treatment provided by the registered dental professional. And it should not be directly made, or it should not be available to the patient directly. Okay, these products cannot be used on anyone aged under 18 year unless it is for the treatment or the prevention of the disease. So these products should not be used on anyone who is under 18, and it should not be used if it's more than 6% hydrogen peroxide. Alright, so products containing or releasing less than 0.1% hydrogen peroxide, these products are safe and freely available on the market. They include mouth rinses, toothpaste, and the tooth whitening products. Not important paragraph. Now, only dentists can prescribe the tooth whitening. So, who can prescribe tooth whitening is the only dentist, not any DCP. Is only dentist who can prescribe it, but it can be carried out by an appropriately trained, competent, and indemnified hygienist, therapist, or clinical dental technician working to your prescription. Sometimes they do give a question on exam that who can perform a whitening procedure. So we remember hygienist and therapist can do, but also the clinical dental technician working to your prescription can do the whitening procedure. A hygienist cannot carry out the tooth whitening under the direct access arrangements. Okay, first application for each cycle of tooth whitening, you should undertake the first application or delegate it to the appropriately qualified hygienist, therapist, or clinical dental technician. Is the uh, same meaning in a same pattern. Thereafter, the patient can complete the tooth whitening cycle at home. A cycle can be taken to mean the time taken to achieve the desired result. So, whitening top-ups, if you provide patient with a supply of a top-up gel but did not provide the initial course of whitening, you must treat this as a new cycle. Okay, so tooth whitening is not suitable for every patient, so it is not suitable for discount vouchers or online schemes to attract the new patients. So that's illegal. Which product to use? The majority of the tooth whitening materials are peroxide based, which, if used properly, are safe and effective. The most commonly seen side effects of transient tooth sensitivity and gingival irritation. This is the common BCQ that comes on the exam. So the transient side effects is the tooth sensitivity, also the gingival irritation. The carbamide peroxide, some tooth whitening products contain carbamide peroxide, okay, which decomposes in an aqueous medium to release hydrogen peroxide, a bleaching gel of 10%. Carbamide peroxide provides about 3.5% hydrogen peroxide. Consequently, the use of products containing 16% carbamide peroxide is permitted. So 16% carbamide peroxide is permitted. and 10% provides about 3.5 hydrogen peroxide. You should confirm with the manufacturer the percentage of hydrogen peroxide released to avoid exceeding the limit of 6%. Now, chlorine and sodium perborate. These are the products which are not used now. So, product based on the release of chlorine dioxide products are harmful. The associated safety issue mean these products are no longer used. Same as with sodium perborate, it is banned because of its toxic nature. Now, that's all for the tooth whitening.